Hello, everyone, and welcome to Medical Sauce, where we make medicine simple, memorable, and fun. I'm Azula, your host for today's episode. Today's episode tackles one safety measure many health professionals do not know or do not pay much attention to. Why shouldn't ceftriaxone be administered through the same IV line while Ringer's Lactate is running? To guide us through this topic is our resident medical expert, Dr. Momo.
Thank you, Azula. This is a very important patient safety topic because administering these together incorrectly can create a serious problem.
Absolutely. It needs careful attention. Dr. Momo, why can't ceftriaxone be given through the same IV line as Ringer's Lactate?
The reason is calcium. Ringer's Lactate contains calcium ions, while ceftriaxone can react with calcium. When they come into direct contact in the same IV tubing or solution, they can form ceftriaxone calcium precipitates.
A precipitate is simply solid particles or crystals that form when two substances react. Instead of a clear solution flowing through the IV line, tiny crystals may develop.
So the problem isn't that either medicine is bad on its own? It's what happens when they mix?
Exactly. Separately, they're safe when used appropriately, but together in the same line, they can become incompatible.
What danger do these crystals pose to the patient?
If the precipitate enters the bloodstream, it can obstruct small blood vessels. This may reduce blood flow to vital organs such as the lungs or kidneys. The risk is especially important in newborns, where fatal cases involving ceftriaxone calcium precipitates have been reported. Even in older children and adults, visible precipitation means the medicines are incompatible and should not be infused together through the same line.
Absolutely. So whenever we see precipitation, patient safety should come first.
Absolutely.
If a patient already has Ringer's Lactate running, how should ceftriaxone be administered safely?
There are several safe options. Use a separate IV line for ceftriaxone whenever possible. If only one IV line is available, stop the Ringer's Lactate infusion. Flush the IV line thoroughly with a compatible solution such as normal saline. Administer ceftriaxone, then flush the line again before restarting Ringer's Lactate. Never mix ceftriaxone directly into a bag or syringe containing Ringer's Lactate or another calcium-containing solution.
So the key is to keep the two solutions from meeting inside the IV tubing. Before we finish, give us a summary.
The greatest concern is in neonates, where ceftriaxone should not be administered simultaneously with calcium-containing IV solutions because of the risk of potentially fatal ceftriaxone calcium precipitation. In older patients, sequential administration through the same line may be acceptable only if the line is thoroughly flushed with a compatible fluid before and after ceftriaxone.
Thank you for listening to Medical Sauce. Share it with your classmates, colleagues, and friends. Don't forget to subscribe. Please answer the following question, and we will give you a shout out in the next episode. Today's shout out goes to Tanatswa Zanaka.